what are the benefits of multiple IVF, or the advantages? First, we have to think that most of the patients that are coming to the clinic are low responders. That is something that we do every single day. In many cases, because nearly 70% of patients who are coming to the unit are more than 37 years of age, and we know that with the age, the ovarian reserves come down. Also, because many of those low responders are because they may suffer from endometriosis, for example, which has damaged the ovary and consequently the ovarian reserve, or because just genetically they don't have a very good number of follicles available. Another reason of the advantages of doing more than one IVF in a row is that the quality of the sperm, because sometimes that leads to bad quality of embryos, and that woman wants to have more embryos to have more chances. So here, under this, when we face this frame, these circumstances, then the woman has the dilemma of saying, well, I want to do an IVF. If I got an embryo, I will go ahead with the transfer. If I don't get pregnant, I will repeat it again and again and again if that is the result is negative. Well, that's pretty reasonable. The other way is, as we are talking today, is to say, well, the plan is that you will go ahead with an IVF, you will have 1-2 embryos in the first attempt, but you haven't finished. Then these embryos will be frozen in nitrogen, and then you will go ahead with a second IVF, maybe with a third one, and at the end of the procedure you may have 6 embryos. So what's the difference? Because maybe the woman who has chosen to have the transfer after the first one is getting pregnant. Well, but maybe not, or she's more likely to have a negative pregnancy test due to the statistically speaking. So that an IVF, the main reason is that to go through an IVF and to have a negative pregnancy test is something devastating for the patient. Most of them are going to give up after a negative pregnancy test. They have done an IVF, they have a negative pregnancy test, and most of them say, well, that's enough. I'm not going through to this procedure again, and they don't have the same opportunities as the other patient who has not have that drawback, that negative pregnancy test. She's just doing the work. She's done adding embryos, and even more optimistic because she sees that in the lab we are keeping more and more embryos. And at the end of these 3 IVF, for example, after having 6 embryos, as I said, as an example, she may decide whether to go ahead with different transfers or even analyze these embryos with a pregenetical diagnosis, PGD, for example. So why is emotionally advisable to do that? Well, because in the end, if we look at the statistics, the woman who has had embryos is more likely to get pregnant because the other one has been transferred probably 1 or 2 embryos, while the other one has the opportunity of having 6 transferred. So the more the better. And also that woman hasn't gone through the second one to a negative, consequently a negative pregnancy test one and again. Because as we said, she may even analyze the embryos. That, of course, the one who has, that woman who has just 1 embryo may analyze with PGD the embryo, but the cost is very high for just analyzing 1, while with the same cost she may analyze 6. So I see just more advantages in these particular cases. Obviously, if we face a case where that woman has a very large ovarian reserve, cancer because of a problem in the ovarian tubes, and she may develop 4 or 5 embryos in a row just after an IVF. She doesn't need to go through this repeated IVF, but these are very few nowadays. Most of them is that type of patient that needs more embryos to accumulate that. What are the principal advantages of IVF if we compare that procedure to IUI? Because when we talk about repeated IVF and to repeat 2-3 IVF, we don't talk about IUI. Well, IUI, it's a very basic technique. It consists of just introducing the best spermatozoids inside the uterus instead of the top of the vagina. Let's say just 4 or 5 centimeters ahead. So if most of these patients are patients in whom we don't know exactly what's going wrong. I mean, to go to IUI, they have to be less than 38 years of age. They have to have the tubal patent, no obstructions in the tubes, and the semen is sperm has to have a very nice quality. So, and then we wonder, what are we doing? Just introducing the sperm in the uterus 4 or 5 centimeters. That's why this technique, IUI, it improves the percentage of pregnancy, the rate of pregnancy, in an 80% if we compare it to sexual intercourse, normal sexual intercourse, without reproduction technique. We said that in these ideal cases selected for IVF, for insemination, the rate of success is no more than 16-17% in 3 months doing IUI. On the other hand, in IVF, then the percentage of success is much higher, obviously, and then we obtain lots of information that we don't have in IUI. In IVF, first, we start stimulating the ovaries, so we see how the ovaries are responding. That's better than anti-mullerian hormone or even ultrasound scan just at the time of the period. Then we really see how much that ovary is going to respond, how many eggs she's going to give. Second, and after the retrieval of the eggs, our biologists can assess the quality of those eggs, which is a very nice information to know. Third, then we will see the interaction in between the sperm and the eggs, the rate of fertilization, and how this important step has happened, because we are in the lab, we have the time-lapse incubators, and we have minute after minute information about these embryos. Of course, how these embryos are doing the following 5 or 6 days till the blastocyst stage, when how they are doing, if they stop the growth or the quality of those embryos. And finally, again, another interaction, the interaction between these embryos, which may show a very nice quality, and the endometrium of the mother. Then we may study the receptivity of these uterus, and even if we come across with a failure of implantation, to study any other things that in an IUI we can't. For example, we may study, as we said, the receptivity, hysteroscopy before introducing the transfer of these embryos, and of course, as we said before, the prenatal, the PGD, pregenetical diagnosis. So these are the main advantages. That's why we are prone to advise the IVF and not the insemination. The insemination is just reserved to a very restricted group of women, very selected, right? So this is the way that is now international agreed to work and to do. Yeah, so finally, why these warranty programs are so interesting? Well, I think that mainly because it gives a peace of mind to the patients. Peace of mind in a medical way towards the results, and economically speaking as well, because they know that they are going to face a procedure with a fixed price, and if there is no result, they will have their money back. And this is quite interesting, because what do we want? Really, we want a healthy baby at home, and as soon as possible, right? And then, for that, the first thing that we need is to see this couple, this patient, okay? And to analyze and to study in depth her case, and to tailor the treatment, because it might be different from one or the other, and to inform her in these cases, like in any other cases in IVF. We want to have a very close communication between patients and us. But in this case, then we will show them what the problem we have detected and how we're going to deal with that. And once we have studied the case, then we like the patient to have a word with our department or our patient service department to inform about with the price, and to have a line of communication, not only with the doctors, but also with our department. So, as we said, this is quite a traumatic period of life, when the woman wishes to have a baby, and at the same time, they are spending a lot of money, many times, to have a negative pregnancy test. We said how devastating it is, and how they have to repeat it again and again to pay a large amount of money, because all these procedures implies a cost, a very high cost. So in these cases, the patient has that peace of mind, I would say, that finally they're going to have a baby, because we are compromising our professionality to do that. And if not, at least they will have the money again to say, well, I want to try again or not, because this doctor have done everything that was possible. But when we go through this procedure, we say, yes, we compromise to our warranty clients because we have faith that she's going to get pregnant if we do things correctly.